Bismillah ar-Rahman ar-Rahim. Dr. Hamza Alsayouf, consultant pediatric neurologist, American boarded. Today, in our sixth episode of epilepsy series in children, we are going to talk about when do we take off the medication and how do we take off the medication. In general, we try to keep the patient well controlled in medication for almost 2 years, and 2 years from the last seizure. Again, 2 years from the last seizure, not from the start of the medication. We would like usually to repeat an EEG, and based on that EEG we will decide how to wean off the medication and what is the chance of having seizure again. That is typically true in partial onset seizure as well as in generalized epilepsy syndrome in the majority of the cases. So after 2 years from the last seizure, we do repeat the EEG. 1 hour EEG, we do hyperventilation and photostimulation. We put the light on the patient to make it flickers, and we make him take a deep breath and hyperventilate if it is possible, and based on that EEG we will decide. There is a 3 scenario in this case. The first scenario, that the EEG is absolutely normal. The patient was easy to control from the start of from the beginning, and then the chance of having a recurrent seizure is basically 30%, which means 30% of the kids who have a normal EEG, they were easy to control at the beginning of the seizure, and they have a normal MRI. The 30% of them, they might have recurrence after we wean them off the medication slowly, and 70% they will not have a recurrence. So your best chance is 70% you are not going to have a seizure. Now, if the EEG is mildly abnormal, it's not very active and it's mildly abnormal, patient had a normal MRI in the past, and also he was easy or relatively easy to control, then your chance is around 50-50 to have a recurrent attack of seizure, mainly in the first 6 months and mostly in the first 1 year, and your chance after that is much less. Now, if we repeat the EEG and the EEG is still very active and the EEG is very abnormal, or we are dealing, for example, with certain kind of epileptic syndrome like juvenile myoclonic epilepsy, these patients, we usually tell them, I would not recommend to wean you off the medication because your chance to have a recurrent seizure is very high because your EEG is very active. Now, this is in general. The way we repeat we wean off the medication, we wean off the medication slowly over 2 to 3 months, and we also make sure the family understand the first aid. We give them a rescue medication like rectal diazepam or bacalmidazolam, and we make sure that they know how to use this medication, and we also make sure they have access to the clinic or to the doctor if the seizure start happening again. We also emphasize for them the seizure precaution. Now, there is specific type of seizure like benign neurologic epilepsy. Usually this epilepsy in the patient need to be treated for almost until puberty, male or female, and most of them, this syndrome or this epilepsy will disappear after that. Juvenile myoclonic epilepsy, it's a specific kind of epilepsy syndrome. They usually need a treatment lifelong, or most of the time when I tell the family they will need a treatment for very long time. We also emphasize to the family that sleep has to be very constant, and we do it over the summer vacation, the weaning off, so the patient is the patient's with the family, he's not under school stress, they can control all his daily activity, and we also emphasize for them no swimming alone. Now, if the patient sees again, once we wean him off the medication, then we put him on the medication again for 1 to 2 years, classically 2 years years, but some family they prefer to repeat the EEG and give a trial wean every year after that. And by far the majority of the patients, 70%, they will eventually, more than 70% to 80% eventually they will outgrow their epilepsy syndrome if MRI was normal and if the EEG was normal or slightly abnormal. Thank you very much, and please wait for us in the next episode, and we will be talking about a specific kind of seizure. We will be talking about infantile spasm. Thank you very much and have a good day.